Hey folks, we're back taking a look at what's going around this morning. And joining us in the studio is Dr. Kissinger from Integris to answer all your important questions. Dr. K, thank you so much. And today we are talking about Skin Cancer Awareness Month. And such an important thing.
Right.
It's an important time of year.
Right.
And tell us, why is it so important?
So it's a big thing because 1 in 5 Americans will get some type of skin cancer. So it's very common, very prevalent. But one of the perks of it, well, not perks of it, but one thing is we can screen for it easily. It doesn't require an invasive test. It really just takes observations. The interesting thing is melanoma is the one we're always scared of. It's very rare, but it's very scary. It's the one that can really cause fatal issues. And then the other big thing is a lot of people don't realize that skin cancer can affect all skin tones. So no matter the skin tone you have, you need to be checking yourself for your moles, spots, things like that.
Important reminder. What's some of the home things that we can do to protect ourselves?
So the biggest thing we're always going to recommend is sunscreen. So make sure you're putting your sunscreen. The weather is getting nicer outside. More of us are getting outside. Put your sunscreen on. The sun is the most intense between 10 a.m. and 4 p.m. So that's really when you need to make sure you have your UV protection. And then if you don't want to wear sunscreen, you can they have now sun shirts and other things like that.
Yeah.
And then make sure to check your moles. So look at your spots, see if you have anything suspicious. If you have someone in your house, have them look at your back, the back of your legs, look at different places just to make sure you have an eye on what's going on.
It doesn't necessarily have to be those spots, like your neck that always sees the sunlight.
Right.
It can be someone on your back that might never see the sunlight.
Right. I've seen it present on the back of someone's leg, and the melanoma has presented on the foot before, underneath the nails. So it can be anywhere. So you really just need a good view of seeing kind of what's going on.
Is there a type of sunscreen that people should use, whether it be like the lotion or the spray, or does it matter?
Whatever you'll use and whatever you'll reapply.
Okay.
So they've shown studies that if you like it, smells good to you, it doesn't bother you, and you'll reapply it, that's the best bet.
That's the important part.
Yes,
right there.
if you get sweaty after about 80 minutes of that, it starts to wear off, and so we just want you to reapply often.
Okay, at what point should people see a doctor?
So if you're ever suspicious about a mole, if it's ever weird to you, you need to get it checked out. We'll do that. If you don't have someone at home that will look at your skin routinely, ask your doctor to take a quick look. The ones we're most worried about are going to be the ones that look asymmetrical, so they're not even, they have a weird border, they have more than one color, they have a big diameter, so greater than a pencil eraser, or they're just changing over time. Those are the ones we want you to get in quick to get looked at.
And just like anything that changes like dramatically.
If it just doesn't look right, let us look at it. It's so much easy. Again, all we need is a pair of eyes. Sometimes the dermatologist will use a special little microscope, but it's an easy thing to check for.
Yeah, better be safe than sorry.
Exactly.
All right, Dr. K, thank you so much. All right, and if you have any questions for Dr. K, all you have to do is go to our Facebook page and post that question, and we'll get it answered right here on Good Day Oklahoma. You can email it to us